Welcome to By the Numbers, a public health podcast. I'm Addie Olson, the host of this podcast and the public health communications officer with the Polk County Health Department. Today, we are diving into a topic that is both urgent and very personal for many. We're going to talk about opioids, the overdose epidemic, and harm reduction. So the number I want to lead with today is 1 in 3. 1 in 3 people say that they know someone who has died of an overdose. And that number comes from the Journal of the American Medical Association, and that was just published earlier this year, the report that contained that data. So we know that it's not just a statistic. It really is a reflection of how widespread this crisis has become and how it really hits close to home for a lot of us. So to help us understand the complexities of this issue, I am joined by Gabby Ruggiero, a program planner with Polk County Behavioral Health and Disability Services. So welcome, Gabby.
Thank you.
And I wondered if you could just kick us off by talking a little bit about opioids 101 and what are we really referring to when we talk about opioids?
Yeah, that's a great place to start. So opioids are depressants. They slow down the central nervous system and they also block pain signals in the brain. So when we're thinking about how opioids can be helpful, there's a lot of medical reasons someone could use them besides pain relief. Things like cough suppression, for example, really helpful, or slowing down the bowel. But for when we're talking about where there's issues with opioids, they also slow down breath rates, respiratory depression, and that's where we see the dangers of opioids because that's what will lead to a fatality is that slowed breath rate, and then eventually the body doesn't have enough oxygen, and that leads to the death.
Okay. So they can either be prescribed or obtained illegally. There are a number of different names, kinds of opioids.
Yeah, absolutely. So when we think about legal opioids, most people will think about things like oxycodone or Percocet, prescribed painkillers that we don't see as much of now because of the dangers of opioids, but still are prescribed regularly. And then we have illicit opiates that are naturally derived from the poppy plant, like morphine or heroin, that are more used illicitly. Heroin, of course. And then we have fentanyl, which is what most people think of now when they think of opioids. And fentanyl is both made legally for medical use. So, for example, my friend had to have his appendix out a couple weeks ago, and when he went into the emergency room with extreme pain, they gave him a very small amount of fentanyl to manage that pain. Someone who has childbirth, for example, that's where fentanyl has an appropriate medical use. But there's also illicitly manufactured fentanyl, or IMF, and that is manufactured in a clandestine lab and then usually laced into other substances or is sold just as fentanyl on the street.
And it's super dangerous, right? Like fentanyl is what we're hearing about a lot. And I was at a presentation a couple weeks back, and they were talking about how 7 out of every 10 pills seized by the DEA contained a lethal dose of fentanyl.
Yeah, so fentanyl is both sold in a way where people know what it is, but there's also fake prescription pills that are being sold. So something that someone might think is an oxycodone or a Percocet or even a Xanax, it's pressed to look exactly like that legal drug, but it's someone who has obtained an illegal pill press and then taken that fentanyl powder and made it to look exactly like that prescription drug. And so public health folks have done a lot of work to try to educate the public that, hey, if you buy something and it didn't come from the pharmacy, chances are it's not real. And yes, 7 out of 10 of those pills that have been seized by the DEA have a potentially lethal dose of fentanyl. So someone who has no tolerance to fentanyl, they haven't been taking it before, that's when we're talking about that potentially lethal dose for that person.
Okay. And it's like a super small amount that can be potentially lethal, right? So you would have no way of knowing if it's in something.
Absolutely. So if you just took a little bit and put it up on the tip of a pencil, that is enough of pure fentanyl that could cause a lethal overdose in someone who doesn't have a tolerance. And, I've heard stories throughout the last 5 years of parents who said, my kid took half of one of these pills, and that was enough to cause a fatal overdose. So it really is just a tiny amount that can cause that in someone who doesn't have a tolerance.
Wow. And are we seeing overdose rates continue to increase? I know that's happened for the last, I think I was looking from like 1989, the overdose rates have just been continually increasing. Is that a trend that we're seeing continue to happen because of fentanyl?
Yeah, so it's a little complicated. So we have seen three waves of overdose deaths. It started in the 90s and then early 2000s with prescription drugs that were overprescribed, and folks became dependent on those opioids and then may have developed addictions to them. And if their doctor stopped prescribing them because they realized at that point how addictive these medications were, then folks started to turn to heroin to replace that opioid that had been in their body. So, first wave of overdose deaths, prescription drugs. And then the second wave was in the late 2000s, early 2010s, where we saw heroin overdoses dominate. And since then, we have seen a dramatic spike in overdoses related to, fentanyl, illicitly manufactured synthetic opioids. And we have done a lot of great work as a community in public health, public safety, and harm reductionists to reduce fatalities. However, if we look at Iowa-specific data, we are nowhere near where we were in the 2000s. We've essentially flatlined over the last couple of years of those overdose numbers, but we have yet to see a significant decrease in overdose deaths, at least here in Iowa.
Okay, that's super interesting. So it's been kind of an evolution in the overdose deaths that we've seen from prescription drugs to illicitly obtained drugs. And the Polk County, or like the Iowa specific data, seeing that kind of flatline in overdose deaths, is that reflecting like the national trend as well?
Yeah, so there have been states that have done more strategic initiatives to reduce overdose deaths sooner. But that also could be because they saw the peak sooner as well. We tend to have drug trends be a few years behind the coast, for example, here in the Midwest. So they've been dealing with this longer than we have, or at least it was more severe for them sooner. And so because a lot of these policies and public health initiatives are reactive instead of proactive, it will take a little bit of time for us to see a decrease in overdose deaths if we continue the work that we're on.
Okay. And are there certain things that you've seen, certain issues that you've seen in Polk County or Iowa that really stand out to you as being bigger problems here than they are in other places?
Access to care is something we really struggle with in Iowa. There's a severe lack of mental health resources, and we know that mental health and substance use disorders go hand in hand. It's really chicken and the egg of how they affect somebody. And there's also a lack of substance use providers and resources as well. And then if you put on top of that the rural-urban divide, and that there are a lot of people who just don't have someone who can treat opioid use disorder very close to them. Maybe their primary care doctor is hesitant to try to help them with that issue, and that's the only healthcare provider that they have available to them in an accessible way. So access to care is something that is not just unique to Iowa, but when you look at national statistics, we really do struggle with that. I would also say, as a state, we are behind on how we look at harm reduction policies, which I know we're going to talk about here in a little bit, but there's a lot of stigma associated with substance use and thinking that it's somebody's fault, that they are a quote unquote addict, or that they deserve whatever happens to them. And while maybe that seems a little jarring when you say it out loud, it's really an ingrained thing that a lot of people hold within them that prevents them from advocating for people who have behavioral health conditions, and really affects how people see these evidence-based strategies that could help people who use drugs.
And it's kind of shocking to think about the lack of compassion that exists for people who use drugs when you think about that number 1 in 3. 1 in 3 of us know somebody who has died of an overdose. And then another piece of that report from JAMA was 18% of people say the person who they know who has died of a drug overdose was a close family member or friend. So I think that, yeah, the compassion for people who are losing their lives and people who are addicted to substances should definitely be a key part of the conversation. And you talked about harm reduction a little bit. So can we segue into harm reduction and just talk about what that is?
Yeah, absolutely. So, harm reduction is a set of strategies and principles aimed at reducing the risks and harms associated with some type of behavior. So, I drove here today and I put on my seatbelt. That is harm reduction. We know driving causes a lot of fatalities. It's probably the riskiest thing I'm going to do this week, this month. So I put on a seatbelt to reduce my harms, but I'm not going to stop driving, even though it's a dangerous thing that I do. Now, there might have been times when I was driving that I didn't go the speed limit. We know that going the speed limit is a harm reduction strategy. It reduces your harm if you do get in a crash. But sometimes I follow that, sometimes I don't. So, harm reduction is not all or nothing. We can take some strategies and leave others when we're engaging in some type of behavior. So, when we think about harm reduction as it relates to substance use, we are adding in that stigma, of course. It's not like driving, that's a pretty destigmatized activity. But with substance use, stigma really tells people that, people shouldn't be using drugs at all. Why are they using? They should be abstinent. And we know that abstinence is very difficult, first of all, because of the physical dependence that somebody has on a substance. And also, there are all sorts of barriers to people getting help for that substance use. So, in the meantime, are there things that you can do to reduce your harms associated with substance use? And the one that people most often recognize is having Narcan or naloxone to have on hand in case of an opioid overdose. So that is a harm reduction strategy for substance use, specifically opioid use. However, there are a whole bunch of harm reduction strategies.
Okay. And I'm glad that you mentioned the term abstinence because it brought me back to my high school sex ed class where they're like, abstinence is the only way that you won't get pregnant or won't get an STI. And you're telling this to a room full of hormonal high schoolers. We know that abstinence just isn't realistic. It's not. And so it's that same type of approach here. There are a lot of things that you can do to prevent harm that aren't just totally not engaging in the activity. So naloxone is a big one. Can you talk about some of the other ways that we can approach substance use with harm reduction?
Yeah, so there are things that people can do regardless of the substance. So if someone is using alcohol, for example, this is just as applicable as illicit drugs to use a small amount and then wait between doses of use. So if you have a drink and then you wait a while, or you have some water between drinks, that's a harm reduction strategy. Route of administration is one for illicit drug users, or people who use illicit drugs. So if somebody is smoking a substance instead of injecting it, there's a reduced risk of overdose. And but then there are other things that are more policy involved. So we in Iowa have a pretty strict drug paraphernalia law. There are other states that have made it legal for people to exchange syringes or needles if they inject drugs. So they're able to get unused syringes for free. And we know that in communities that have implemented these types of programs, their transmission of HIV and hepatitis C have gone down by 50%.
Wow.
So so that's huge in the public health space, right?
Mm-hmm.
But unfortunately, because of our paraphernalia law, we cannot have syringe exchange programs or syringe service programs. Another harm reduction method that has been in the news more recently, or people are talking about more, are fentanyl test strips,
Mm-hmm.
where you have a little strip of paper that looks like a COVID test, really. It's just two lines that'll tell you yes or no. You have some of the drug and water, and you stick that paper in there, and it will tell you if there's fentanyl in it. Now, this isn't going to take the fentanyl away, but it can give people information and choice as to what they're going to do next. So they might decide, I don't want to have this at all. Or if I do have it, I'm going to make sure that someone else is there with me that has naloxone, or I'm not going to use as much. So that's also something that is illegal in Iowa. They could be considered paraphernalia, I should say, is a more accurate description instead of legal or illegal. It could be considered paraphernalia. That we're a little bit limited on policy there.
Okay. So some of those strategies, like the test strips and others, are considered paraphernalia. You can't have them, but Narcan is not, right? And we're doing what we can to get that distributed across the community.
Yeah, naloxone is more widely accepted as something that we should have available to us to use for people who are using substances. So Narcan is just the name brand nasal spray of naloxone, which is the generic medication name, in case anybody needs to know. So this is a medication that will only work on opioids. It does not work on any other drug, but because fentanyl is laced into a lot of substances, it's good to have on hand and use, because it will not hurt a person if you use it. I have it in my, and they're not on opioids, I should say. So I have it in my bag right now. I could give it to myself right now while I'm talking on this podcast, and I could keep talking to you. Nothing bad would happen to me now. Nothing bad would happen to me a week from now. So I really advocate that folks have that on hand everywhere, both in private spaces and public spaces, because you really don't know what people are going through, and substance use affects all folks across demographics, different places, people we know, they might not have told us. So really good harm reduction strategy to have. And from a public health perspective, we've done a lot of good work to make this more available in the community. You can get it over the counter now. The FDA approved that. And there are some state-ran programs where you can get it for free. Unfortunately, if you buy it over the counter, it's $40. And I don't know about you, but I don't really want to spend $40 on something that I might use.
Mm-hmm.
So having it for free is really what we need to promote. And for example, in Iowa, you can go to select community-based pharmacies and ask for it through the state program, and they should be giving it to folks for free. You can also do a telehealth appointment and have it sent to your door for free. And more organizations are having lock boxes or just boxes in the public space where you can just go up and take the naloxone from that box for free, no questions asked. And then there, of course, are harm reduction organizations that have been peer-ran spaces and folks that have been delivering naloxone to people far before the public health space really tried to promote naloxone. So they're really they've been here all along doing that work, and we're really as the public sphere just trying to catch up with a lot of what they've been doing.
Sure. And we have boxes at the health department. We have a lockbox at the health department that has a bleach kit for needles. So you can use that to clean needles and hopefully reduce the risk of the transmission of like a bloodborne illness. But it sounds like there are a number of ways that you can get a hold of some naloxone, and hopefully that effort will continue to evolve and more will become available in the community.
Right. I will say that we have done a lot of good work, but in 86% of overdoses in Iowa in 2022, there was at least one potential intervention that could have happened to prevent that person from overdosing. So 86%. And a majority of that has to do with bystander intervention. So just being ready and having it on hand. So the people who really need it, the people who are actively using substances, we still have a lot of work to do to get it into their hands. But of course, everywhere we have it, it is a win.
And it's super simple to administer, right? I was at a training a couple weeks ago, and they just showed us that you like sprayed in somebody's nose the same way you would like the allergy nasal spray that I use in the morning.
Yeah, no, super easy. You take it out of the package, you put it to that person's nose, you spray, you press the plunger on the spray. I tell anyone if they can move their fingers, they're able to give someone Narcan. And then you wait 2 minutes, and then you give the other dose. And the biggest indicators of an opioid overdose are that depressed breath rate, so really slow breathing. Sometimes there will be a rattle noise that happens when folks breathe. And then also just not responding to stimulation. So if you rub their sternum or pinch them, yell, anything like that, and they don't respond. Of course, if you know the person, you see evidence of drug use, those are indicators. A classic indicator is pinpoint pupils. But if someone has been using multiple drugs, they might not present with pinpoint pupils. And we know polydrug use is really common, especially here in Iowa. People usually aren't just using opioids. They might be combining with a stimulant. And there were actually more stimulant-involved overdoses in Iowa in 2022 than there were opioid-involved overdoses. Now, they're pretty close, but there are a lot of folks that are mixing those two, and so I just like to throw that out there that if someone doesn't have pinpoint pupils, you should probably still give them Narcan if all the other things are there.
Okay. And if you're using with somebody you know and the person you're with overdoses and you call the police and you've also been using, are you going to get in trouble?
So in Iowa, we have a Good Samaritan law. Now, there are some limitations to that law. If you have an outstanding warrant, if you sold that person the substances, then you're not going to be protected by the Good Samaritan law. Also, if you weren't the first person on the scene. But if you are in good faith calling, you stay there, you talk to the EMS police when they arrive, and even if you have the substance on your person, if you have paraphernalia, there's also a charge where you're just in the presence of people using drugs. I can't remember the exact name of it, but you are immune from those particular charges when you enact the Good Samaritan law. And that's something that's applicable to other substances outside of opioids. It's a great thing to promote on college campuses regarding alcohol use. But we do have a law. Unfortunately, it's a pretty narrow law, so a lot of folks don't use it because they're afraid that they're going to be arrested, and there's a lot of trauma associated with incarceration. So an advocacy piece is to expand our Good Samaritan law to encourage more folks to call 911.
Got it. And what else can people do to prevent overdoses in our community and just get involved in harm reduction efforts or other efforts to combat the opioid crisis?
Oh, that's a difficult question. So the first thing I would say, and it sounds cheesy, but there's a harm reductionist that I heard, I believe it was here in Iowa, the director of Iowa Harm Reduction Coalition, that said listening is harm reduction. And truly, if someone is feeling isolated, alone, if they have a mental health condition, a substance use disorder, and they have the courage to reach out to someone to ask for help, what you say in that moment or how you react really matters. So having an open mind and listening, and even if you don't know what to do in that moment, saying, you know what, I'm not an expert, I don't know, but I'm going to hold your hand and we're going to get through this, and I'm going to help you find somebody who does know how to help you. Even admitting that I don't know, but I'll be there for you
Yeah.
is so crucial. And other things that we can do specifically with harm reduction would be to think about the public space and how people talk about drug use, and almost being an everyday advocate to work on destigmatizing these topics. So if someone brings up naloxone and says why is that so important, or does that even matter, or people, if they're using, they deserve to die anyway, which I have heard that before. Just again, even if it's not perfect, saying something along the lines of, actually, it's a really helpful thing to have, and a lot of people know someone who's died, and people can't get help if they're dead. Again, it's sometimes we, in our public health sphere, we go like, oh my gosh, but these are things people will say if they're active users or if they're EMS and they've seen a lot of difficult situations. So just having the courage to talk about these things is really something that anybody can do. And then, advocating is kind of the next step after that.
Okay. So just like having the conversation, listening, being there for your people when they need your support, and like destigmatizing the conversation, destigmatizing drug use is a harm reduction strategy in itself, really, right?
Yeah, absolutely.
Okay. Anything else that you would want folks to know about today's episode?
Yeah, I want to leave with a message of hope and recovery. It can be really depressing to listen to podcasts or any media talking about the overdose epidemic. But I was recently looking into Recovery Month, which is in September, and SAMHSA had a statistic that 7 out of 10 people with a substance use disorder or mental health condition in the United States identify as being in recovery, which was really a great thing for me to hear when this is my job. I think about how we can help people all the time. It's like, wow, there's so many people that have made it happen for themselves. And there are formal supports for recovery in our community that are really becoming these centers where people can feel that non-judgment and have a safe space where there are other people with lived experience they can connect with. Here in Des Moines specifically, we have Rise Recovery and Full Circle Recovery Community Center. So these are organizations that are providing formal recovery supports. And recovery is a term that anyone can use. If they identify they're in recovery, great, then they're in recovery. So if someone is actively using and they're curious about these places, they can go and find peers. And something that I definitely want to end on is that it's so important to support people with lived experience being in roles like ours in decision-making spaces, and to really listen to what they say works and doesn't work. And when they're in these spaces like the recovery centers, you see just this wonderful community happening, and we need to elevate their voices and make sure they are heard. And I would encourage folks to seek out resources where they can hear from people who have been directly affected by the overdose epidemic. A great place to do that is the National Harm Reduction Coalition website. They have a video about what harm reduction means to them, where you can hear people with lived experience talk about substance use in their life. So that's a really big takeaway that I hope that people will remember.
I love that. Ending on a positive note. So 7 out of 10 people identify as being in recovery. So recovery is absolutely doable. And if you are working on yourself and seeing that for yourself, then you could make it happen. And where can people go for, like, is there an easy one stop for information and resources?
Yeah, I would recommend naloxoneiowa.org for anyone in Iowa that is seeking information about getting free naloxone. I already mentioned the National Harm Reduction Coalition, but we also have an Iowa Harm Reduction Coalition that has a great website with a wealth of information about harm reduction initiatives in Iowa. They also have a brick and mortar in Des Moines where you can seek resources. And if someone is seeking treatment resources and they don't know where to start, Your Life Iowa is a great resource where you can call, text, chat online, use their website to find appropriate treatment facilities. They also serve as a crisis line. You can call with any issue related to mental health or substance use, and there's someone there that can connect you to mobile crisis if needed. So yeah, Your Life Iowa, naloxoneiowa.org, National Harm Reduction Coalition, and Iowa Harm Reduction Coalition are all great resources.
Awesome. Okay, well, thank you for joining me today, and thank you for the work that you do and just everything you do to amplify the voices of others and those with lived experience, because we know that is really key to making any of this work. So thank you if you are still listening into this episode of By the Numbers, and be sure to follow us on the Polk County Health Department's social media channels for future episodes.